Good afternoon, everybody. Thanks for the introduction, Claire. I'm Alasdair Kilpatrick. I'm the Interim Programme Director. I want to focus on the interim, more of that soon. So the purpose of this session today is just to kind of bring the group here up to date with what we're doing on HSC Digital for the purposes of digital dispatches. So a bit about where we've come from, what we've done, and where we're going, really. So first of all, kind of a bit of a background as to where we got here. So, I mean, the idea of shared services is clearly not new within HSCNI. There's lots of stuff delivered through shared services at the minute. Finance, HR, logistics, procurement, legal services, and a range of others as well. The concept of IT shared services kind of isn't new either. So going way back to kind of 2015, that sort of scoping study into shared data centers and IT support was one of the first ones we're aware of. One I was kind of personally involved in with my Deloitte hat on was back in 2016 when David Bingham was chief executive. That's how long ago that was. We looked at the feasibility of extending the current scope of IT shared services, and that was a fairly chunky bit of work with lots of engagement with people across the sector. And the conclusion of that was absolutely it was feasible and actually preferable to expand IT shared services back then. A number of other ones there as well. I kind of highlighted in bold some of the kind of the key ones. So the infrastructure and applications review back in 2018, which I think BSO led on, which Trust would have been heavily involved in too, looked at this concept also. This was the key one in terms of why I'm here today, if you like, was the PSSP, the Public Sector Shared Services Programme. So Stephen Porter, as he's on the call today, was seconded into that programme to lead on the technology side of that, which covered health, further education, central government, and looked at the possibility of much more broader shared services across the public sector. I guess the conclusion of that was a kind of a health sector work program, which basically recommended again the extension of IT shared services within health. And that then led directly to a kind of a mandate from the Permanent Secretary, Richard Bengelli, to go and establish what was originally called the Digital Shared Services Programme. So it's going to be renamed HSC Digital. And as Claire said, we've been involved with this programme from about June 2019 in an advisory capacity. And then I took on the Programme Director role in September 2020. I've been trying to kind of see this programme through from then. Shane Devlin, who's the Chief Exec of Southern Trust, is the SRO in the programme. So I've been working closely with him on the programme board to try and progress this. So I just want to go into a bit around kind of the main things we've been working on to try and progress this programme and try and progress IT shared services. So there's kind of two main deliverables that we have been working on and continue to work on. So one's called the blueprint and one's a program business case. So the blueprint, I suppose, to my mind, is the key one. I've been working on quite a lot, and it's at the point now where it's pretty much solid. So the blueprint really is the document which sets out the scope of services that shared services will deliver. And the reason I guess that's important is because when you say IT or ICT or digital or whatever you want to call it, there's lots and lots of different things which potentially fall within that. So we felt that it was important, first of all, to kind of define what was in scope and what was out of scope. Now, sometimes that's reasonably straightforward. So, for example, if it's something like end user computing or hosting and stuff like that, it's pretty clear. But for some other sides, which things like program management, project management, business analysis, stuff like that, it's a bit more tricky. So we basically went through a process involving the trusts and BSO and lots of stakeholders to work through and document what this scope actually will be. And just in terms of the second bullet point here, so to make this point again, so it's ICT services, but that does not necessarily mean it's just ICT functions within organizations. So if you look at something like mobile telephony, for example. So mobile telephony is within scope as defined within the blueprint. And in most organizations that dealt with through ICT, but in some organizations, the Estates Department dealt with those services. So it doesn't just affect, ICT services organizationally, it's estates and informatics as well. So the blueprint's been an important document, and I'll go into that in a little bit more detail in the next couple of slides. The other one then is the business case. So no self-respecting program can go anywhere without doing a business case to try and justify where you're spending money. And the reason it's a program level business case is, I mean, our focus has been on getting a program team together, a scale program team, to essentially affect the transition of services from trusts into BSO and into the shared services organization. I mean, the background here, as you'll know, is that the current delivery model for ICT across HSCNI is essentially based between some departmental responsibilities, some health and social care board responsibilities, some BSO responsibilities, and then trust responsibilities. So it's very much a federated model at the minute. And that model has been in place for many, many years. I mean, it's clearly been changed by RPA and various other initiatives around that, and a general move towards regional applications and regional systems. But by and large, the system and the structure in the organization has been there for a long time. So it's a fairly complex undertaking to try and, I guess, disentangle some of those things and then put it together into one place. So the idea was then to get a program team in place to do a lot of the detailed work and the design work around that, if you like. So that's the kind of the business case we've been working on. And then subsequent to that, they'll likely be what we call child business cases. So take a case in point, something like networks. So it's likely that as we go forward, if you want to move to a regional network or a regional hosting or service desk, whatever it might be, there'll be investment in infrastructure and services required after that. That's not covered within this program business case. That'll be covered in subsequent business cases. So in terms of the blueprint itself, so one of the things we did at the start of the development of the blueprint was to try to design a set of design principles to try and guide all of the different options we had. As you would imagine, when you kind of engage with stakeholders in this, there are an infinite number of options that you might take to do this. So we thought it'd be a good idea to kind of put a stake in the ground and set some design principles to help test direction, ensure people understood where we were going, kind of force some applications to be considered, and also to look at kind of design and governance as well. And like most good things, we started off with a very small number of design principles, but they never survived, and we ended up with kind of more. So I think there's kind of 13 or something like that we ended up. So I don't want to go through all these given time and the fact that it's probably relatively dull, but I just want to focus on a couple of these, some of the key ones, if you like. So, I mean, the idea right from the start was that this shared service organization would sit within BSO. I mean, there was an initial conversation at the start, which is around, well, should we set up a brand new entity, a legal entity to do this? But BSO is kind of legislatively enabled, if you like, to be the shared service provider. So that was kind of clear from the start. But it's also clear that this is going to be like a regional entity to point 3 under operations. And one of the questions we're kind of often asked for this is that, and by staff who currently work in IT, is that, does this mean that when you implement shared services, all the staff are going to be in one organization and in one place? And the answer to that is, fundamentally and absolutely not, if you like. So, I mean, IT services require, in many instances, people to be on site to do things, if you like. And then there's also just kind of practicalities around, being close to users and issues like that as well. So it will be a regional entity, but there will be on-site, off-site, what we call near-site staff as well. So as happens at the moment, so if you're in the Northern Trust, for example, at the minute, you might be in Ballymena, but need to travel to Coleraine rather than traveling from Belfast or somewhere else, if you like, as well. In terms of the services side of things, I mean, services and governance has probably taken up most of the time and the discussion at program board and with stakeholder engagement as well. I mean, one of the clear concerns in this is that as we move services into a regional organization, that you don't lose some of the benefits of having a kind of a federated model at the minute. So particularly in the trust structures where they've got their own boards, their own chief executive, and their own IT functions that report directly through that structure. And they're accountable to the chief executive and the board for the services you provide, as is ITS in terms of BSO. So this whole idea of kind of accountability for services is really, really important. Whatever we do in relation to this, the shared services entity, HSC Digital, needs to be clearly accountable for the services that delivers. And there's the other thing which kind of has been important going through this is the idea of kind of innovation and service improvement. So it's important again that in the move to a kind of a regional service, that we don't lose that kind of momentum that we've got at the moment around being agile, being responsive, and responding to the needs of patients and clinicians as we move forward as well. And kind of last but not least, the people bit at the bottom. I mean, the more that I've been involved in this program over the last 2 years, the more kind of we recognise, and maybe I'm just a slow learner, as I say, is that the top four are important, but the bottom ones are the most important. I mean, fundamentally, though, this sounds like IT shared services, and it is IT shared services. It's the people bit that is the most important part of this, because essentially the hardest and that's the most difficult part of this is the transition of people and culture and services into a new organization within BSO. Talent and all the concerns of staff and so on as well. And we've done quite a lot of work engaging with trust and ITS staff just to kind of communicate what this is about, what it means for them. But there's definitely a lot more work that we can do in that, and we'll continue to do in that as well. Okay, so in terms of scope and what this is about, so at the very start of this, and Stephen Porter to thank for this, so Stephen, thank you. We basically tried to come up with a framework which is how we describe in a consistent way what the scope of HSC Digital was. So we used this kind of service tower model. So the towers are the kind of 9 verticals that you can see on the screen there to kind of describe what each of these were and what was included within them. And then we used that as the basis for facilitating discussion with trust, BSO, and with service users around what would be best delivered through shared services and what might not be. Now, most of these verticals are reasonably self-explanatory. So end user computing is PCs, laptops, mobile telephony, things like that, networks, hosting, comms, pagers, radios, and stuff like that. Service desk, whenever you pick up the phone and try to get help with something, whenever you phone the number within your trust within ITS. LOB, is line of business application support. So in infrastructure and applications review that I referred to previously, identified, I think, over 1,000 applications in use across health. Now, it's a classic case of, there's a small number of big ones and then a very, very long tail of small ones. And some of these are regional and some of these are absolutely not regional. And some of them are applications which are common between trusts, for example, but they're implemented in a different way. So take Paris as an example, the community system and mental health system. It's in use within some trusts, not all, but there's separate implementations as well. So this is a significant part of what trust IT staff do, and they're really important applications in terms of the day-to-day operation of the health system in Northern Ireland. So trying to figure out how we support all of those line of business applications has been a really important consideration as we go through this. And then the other 3 are fairly self-explanatory. The ones below are kind of what we have called capabilities, the kind of horizontal bars, if you like. So they don't fit neatly into any of the kind of the vertical towers, but they're very important in their own right. So just picking a couple of those. So cyber, as you probably know, has been in the news quite a lot recently, over the last number of years, but certainly in Northern Ireland and the island of Ireland over the last couple of months it has been. So as you'll know, there was the cyber incident at Queen's. And that had a direct impact on HSCNI due to the med school at Queen's. And I think actually email access was cut off to that for a time when they remediated that situation. And then you've also seen the health service executive and the dreadful impact that the ransomware attack had down there as well. So cyber is definitely it was already high up in the agenda of the cyber program that's in place already, but it's certainly in terms of our program is having an immediate impact on what it is we do and how we progress this. I guess the reason for that is that doing cyber in a distributed way is not a good way to do it. Doing it in a much more controlled regional way is definitely the way to go. So that's been one of the factors that's led us to adjust our approach and adjust our business case as well. Business relationship management, just to touch on that. So this is the idea that whenever you get into a regional shared services entity, it's really, really important that you look after your customers, because that's essentially what a shared services organization is. It's a supplier and your customers are there, and the customers might be internal. So you're all within HSCNI, all part of one big happy family. But the business relationship management in terms of understanding the needs of your customers, understanding where they want to go to and meeting their needs through service levels and others is really, really important. The importance of governance, I've mentioned already. I mean, that's critically important that we get it right. And this we've spent quite a long time working through that with trusts and BSO and at DHCNI to figure out what the best way to do that is. And talent is really important as well. I mean, I mentioned people in terms of the design principles already. mean, we've done quite a lot of work on due diligence and trying to find out, how many people we've got and what they do at the moment as well. But talent is a huge issue, generally within the health service, as and IT is no different in relation to that. There's we call it in Deloitte kind of the war for talent, if you like, in terms of trying to get people into your organization who are the right people, who've got the right attitude, enthusiasm, and passion for what they do. So we certainly see that shared services and HSC Digital provide some opportunities in the talent space, and I'll talk a bit about that in the final slide. So this program has been kind of quite challenging in terms of trying to figure out the best way forward in this, because IT's, the people who work within IT are really passionate about it, number one, and number two, it's a critical part of keeping the lights on within the health service here. So one of the things we did was to look at what are the key variables are in terms of how we might take this program forward. So when we kind of took a step back, and this was kind of probably about September 2020, whenever I kind of took the role on an interim basis as program director. So we had the two key variables. One was organization, and one was how we would transfer staff and services, if you like. So organization-wise, essentially it boiled down to kind of two choices, accepting that BSO was going to be the kind of the home for HSC Digital. So our first option was around basically taking the staff from trusts primarily and putting them into ITS and then doing a bit of a rebrand around that. And then the second option was around setting up a brand new division within BSO. When we called it HSC Digital, and then existing trust ITS staff transfer in. Now that doesn't seem like a big issue maybe, but certainly working with the trust and the program board and BSO, this ended up being a really, really important design point for us. And then secondly, the kind of the staff and services transfer, and it says that boiled down to two main options. So one was a kind of a single transfer of staff and people. So this is, if you think RPA, how that was done, it was kind of, there was a day one, which is the 1st of April, whenever that was many years ago. So one day you're in the Southeastern Communities Trust, and the next day you're in the Belfast Health and Social Care Trust, and that happened on day one. So that's a bit like that. And the other option was a much more phased transfer of staff. So we looked at both of those, and fundamentally, the kind of the consensus from the program board and from the engagement was that in terms of the organization, it was important to kind of have a new start in terms of shared services. And I guess that's for a couple of reasons, but mainly because ITS, which is the current shared service within there, delivers a certain range of services, and it's currently got about 400 people in there. When this is complete, it'll probably double in size, and the scale and the nature of the services it provides are fundamentally different to what it does today. So it kind of needs it's a new start for BSO in terms of delivery of these services, but it's also just a signal that, culturally, this is a different organization. It's a new opportunity to do something great within the health service here in terms of technology. So we plunked for that kind of right-hand option, which is this kind of new function within BSO called HSC Digital. And then in terms of staff transfer, we ended up with kind of a phased transfer option. And that was mostly just around risk mitigation. So, as I said before, IT services have been delivered this way for many, many years. Clearly, they're changed all the time as organizations change and new systems and infrastructure are implemented. But fundamentally, it's been the same for a long time. So we're seeing that, and some of the lessons from BSTP are in this as well. So the general feedback was, let's do this in a phased way to kind of minimize the risk. So let's do a service or a group of services first, make sure that's working well, and then you'll have a solid foundation to go forward to deliver these. So this slide's much too long, and I'm not going to spend any time on this, but this is the kind of the long list of options we had in the business case, and I'll try and summarize this as best I can. Option one essentially was a kind of a one-phase approach to this, and that was originally kind of where we were heading. And then there was a bit of feedback on that, and we ended up with kind of option four. And option four is more around a kind of a phased approach to this. Where we've got to quite recently, though, is where we've submitted the business case to the DHCNI and to the department, got some feedback on that. But based on some additional feedback and some broader context happening, cyber being a case in point, which I've already mentioned, we're currently going through and redoing the business case to add an additional option 5, which is essentially, instead of designing all of the services up front and then implementing them, we're looking at an option which is more of a kind of a lift and shift. So we basically take, for a group of services, the staff, the services, the budget and the contracts, and put them into BSO, HSC Digital on day one, and then start to implement those afterwards. But we're still working through these options, still evaluating them, and the plan is to submit a revised business case to DHCNI and then onto the department next month. So that's something we're working on at the moment. So it's there's a lot of factors involved in this. There's legal factors, there's HR factors, CHIP-A, staff transfer factors, contractual issues. So it's a very, very complex picture, but that's a bit we're kind of working through at the moment and trying to come out with an option which is, A, deliverable, B, affordable, and C, something which, the customers in terms of the trusts and the supplier in terms of the BSO are content with, if you like. Yeah, one of the other factors that has come up as well is around, so when we went out to talk to staff, they said, well, okay, that's all well and good. I said, but if I'm working in Trust A, when am I going to move to HSC Digital? And, when you go out to talk to staff, I think most staff kind of think, yeah, they understand that this is probably a good idea, but they want to understand, what will this mean for me? Will I still have a job? And, where will I be working? So what the program board basically asks us to look at, okay, if you're looking at the phasing of how this might work, what might that phasing look like? So what we did was we come up with a kind of a straw man or a straw dog, as Dan West calls it, because we want to use some gender neutral terminology. So we looked at a kind of a straw dog solution to this, which looks something like this in terms of how we might phase these services. So if you were paying attention earlier, there was those 9 service towers, if you like. So these 9 service towers are reflected in this diagram. And there's an additional one, which is cyber, which is in phase 1A in this diagram. The reason why cyber is in it now is that there's a kind of a recognition that we kind of can't sit and wait for shared services and other factors to come to play to do something about cyber. And cyber is certainly a very, very strong driver in terms of how you pull these things together. But the tricky bit about cyber and trying to do something about that regionally is that cyber is not a service tower. It doesn't sit neatly in one area. Cyber cuts across hosting, networks, end user compute, comms, all of those service towers, if you like. So we had a first go at what phasing might look like. But if you imagine this is kind of 2 phases, so phase 1, phase 2, with phase 1 kind of split into 2 pieces here. Now this is just for the purposes of recording, this is an indicative phasing. We've been around the trusts and BSO having a chat with this, and we've got some feedback on this, but it survived reasonably intact actually, and there's what this might look like. The idea behind this is that phase 1 essentially represents kind of the core compute capacity of HSCNI. So for example, whenever you come in to work in the morning, or whether you're in the trust or BSO or whatever setting you're in, and you switch on a device, be it a mobile phone, a radio, a pager, a PC, a laptop, tablet, a video conferencing unit, whatever it might be, these are the things that all work together to enable you to do that, if you like. And that's what we're looking at in terms of phase 1. The difficulty with doing it in a kind of a more subdivided way is that these things are all connected. So hosting is connected to networks, which is connecting to end user compute. So if you try to start to split these things up, you're almost creating work for yourself, if you like. So it's really, really challenging to do that. And then there's a phase 2, which includes line of business and those other service towers there as well. But this is kind of a work in progress, if you like, and it undoubtedly will change as we go through the process as well. But it's just to give you an idea of kind of initial thinking on how we might implement this in terms of the phasing. Okay, so finally, in terms of where we're at the minute, so I'm a kind of a glass half full person, always have been, always will be. And I think that HSC Digital is an opportunity to build a really best-in-class IT function. Because I work in the private sector, and I've spent most of my life working in the public sector, and in the last 2 or 3 years, most of that's been in health. And the quality of the people that work in IT and HSCNI is second to none. I think the challenge, though, is that by having them all in different places, you're not making the best use of that. And I think by combining those skills, those resources, and that expertise together in one place, there really is an opportunity to create something brilliant out of that. And funding is a huge challenge, as you'll probably heard from Dan West and more generally within the health service. So certainly getting the funding together in one place and trying to drive some economies of scale and trying to, invest in IT. I mean, the benchmarks that were done previously have identified that, compared to comparative organizations, HSCNI spends is under benchmark in terms of what it spends in IT. So HSC Digital isn't about saving money, but if we do save any money, it's about reinvesting that back into the service and making it better. I think second point there, it really does create new opportunities for staff, IT staff across HSCNI. So for example, if you're really passionate about application development or data or analytics and that sort of stuff, I mean, there's going to be better opportunities to do that because you're going to have a data team, you're going to have a bigger networks team and a bigger and a better structure within that as well. HSC Digital clearly supports the regional approach service delivery, which is where things are going at the minute. I think I've already mentioned the value for money stuff. And just in case I forget, this is an IT project, but it's not really. This is essentially a HR program, and the whole culture and organization bit is critically important. So we've probably spent more time in the last year focusing on the HR side of things, and we're currently trying to recruit some HR people into the program to help deal with some of those issues and plan that out in a bit more detail. So in terms of what's next, so we're doing what we call kind of phase naught, the prep phase at the minute. So we're doing some kind of due diligence around HR, finance phasing, and doing some more stakeholder engagement as well. We're working through a revised program business case into this new option 5 as well, which I touched on briefly there. And then the sad news, for me, is that they realised I'm not so good at this job. So we're in the process of recruiting a non-interim program director from within HSCNI. So those interviews have taken place, and that appointment process is almost complete. So there'll hopefully be a new person in post from September to take this forward. But I'm kind of hopeful that I'll still stay involved in some way in the program. But it's a really, really exciting program. There's huge opportunities to do good things as part of this. And it's also really strongly linked to some of the other programs you've heard about as well. So things like NIPIMS, NIPAX Plus, DIS, Encompass, et cetera, et cetera. So shared services will end up being kind of an enabler for all of those programs as well. So really, really exciting program.